Emergency medical responder responding to a school stabbing. Does anybody know what happened here?
Yeah, John, we were changing classes, and John was just walking down the hall, and this other kid came running down the hall screaming, ran up to John, stabbed him in the chest, slashed at him, and John just sort of fell over on the ground, and the other kid ran off down the hall.
Where is the kid now?
The resource officers have him down there. They put him in handcuffs.
Okay, the scene is safe. BSI. Home Center, we need an ALS unit to report to 450 Grover Road for stabbing. The witness saw him crumple to the ground, so I'm not going to do a C-spine. Sir, are you with me? He moans in response to verbal stimuli. The patient is cyanotic, so I'm going to open his airway. The patient is conscious and no adjunct is needed. The breathing is shallow at 34, so I'm going to put him on oxygen by a non-rebreather mask for 15 liters per minute. His pulse is 140 and he's cool and clammy. I'm now going to put an occlusive bandage, 3-sided, on for his right sucking chest wound. I'm going to apply sterile water to a towel to put over his exposed organs, and then cover it loosely with an occlusive bandage. And now I'm going to do sample. He has been stabbed in the chest and the abdomen, and he's wearing a medical bracelet that says he is allergic to nuts. Is there a responsible adult here?
Yes, what you need.
Does he have any medications?
He just has an EpiPen in the office for his nut allergy.
Does he have any other conditions?
Other than the nut allergy, no.
Do you know when he ate or drank anything last?
We had lunch 25 minutes ago.
And what events led up to the stabbing?
Just what that young man told you. He was walking down the hall, and the other kid ran up and stabbed him.
The patient's color has improved with oxygen. I'm now going to do a secondary assessment. Checking his head for DCAT BTLS. Checking his face. Now checking his pupils to see if they are round and equal and responsive to light. I'm going to check his neck. His trachea is in line, and he has no deformity, and JVD is absent. His right bandage is, his right occlusive bandage is fine. I'm checking for other DCAT BTLS. He has unequal breath sounds. I cannot palpate his abdomen because of his injury. Checking his extremities. Sir, can you wiggle your toes? He can. There's a pulse present. Pulse is present. Can you wiggle your fingers? He can. Pulse is present. Can you wiggle these fingers? He can. Pulse is present. His blood pressure is 100/55. His pulse is 130. His respirations are 26. I'm going to constantly assess this patient, and transport arrives. This is an 11th grader named John. He was stabbed in the right chest and the abdomen, and his blood pressure is 100/55. His pulse is 130, and his respirations are 26. He's allergic to nuts, and he has no known past history.
Thank you very much. We'll take over.